So during our prep calls, which we did separately, I pitched both of you as like, when are the robots doing the surgeries? Everybody wants to know about robot surgery, and the both of you kind of had the same reaction and sort of shrugged and was like, Dan, the robots are not doing the operations. And I'm like, well, I think you should come to the conference anyway, and maybe you have other things to say, and I'm not changing the description on the website. But as we were talking, Ed, you compared. I want to talk about the new technologies that's entering the surgical room that no one sees unless they watch, the pit, right. And what's really happening and what's really going on there. And Ed, we were talking about how to explain this to people, and you liken the surgical field and the technology that you're bringing to bear to being similar to finding a copperhead snake in the woods.
Thanks for bringing that up. That was an experience that I had. People ask, like, what does a census do? Or what is it that, your group is trying to do more of? And it's this kind of digital surgery or digital kind of space. We have a robotic system that, you move over here and the arms move over there on the robotic side. But what we're really excited about is introducing these digital solutions. And it kind of dawned on me, I was out walking the dog, just to bring it together for this group, is that, don't usually take the little shortcut through the woods on the dirt path, but I decided to do that. And I'm standing there, as you do, as the dog is kind of smelling around or whatever. And so I take a picture of this plant, this plant here and this plant here, and then Google tells you what that plant is, and it tells me what's in that scene, and it said, well, it's plant A, plant B, copperhead snake, plan C. And I was like, wow, okay, like I couldn't see it, and so I typed in there, I can't see it. Really? It said, believe me, it's right there. It said back to me, it's right there, step back, and I pulled him back. I never saw it, but that's kind of what we're trying to do in surgery, is say, and our group is trying to look at that surgical field, and when we look with my background in laparoscopic surgery, as we kind of look around at the intercorporeal environment or at the anatomy, we see what we see, and we look around, but maybe there's things there that we should be seeing that we don't necessarily see that could be brought up. So that was the example that I mentioned to Dan as to what, in the larger sense that we're excited about and some of the things that we're doing.
And did you ever see the snake?
Never saw it. And of course, I got a little bit nervous. I'm trying not to drop my phone, holding the leash and everything. Try not to drop the phone right where it supposedly is. But no, I never saw it.
So, Bill, Medtronic, obviously a manufacturer that makes all sorts of different medical devices, medical technologies. Maybe we could start with the Hugo and what that device does. Device system, probably a system, and how it works.
Yeah, so similar to what was just described of a surgical robot. And this is a system, an ecosystem, I think is the right way to describe it, that's used to make surgery less invasive. My grandfather was one of the first oral surgeons in the state of Indiana, and my mother was a scrub nurse, and she always told me that the best surgeons are the ones with small hands. Why? Because they made smaller incisions. And I think that's really the purpose of the robot, is you can make instruments that have the same dexterity as a surgeon, but they can go through really small incisions, right? That allows people to have less pain. They recover more quickly. And you're operating it's a remote environment because it's inside the abdominal cavity, and you're using visualization. And so that's where being able to recognize the scene, where you're bringing a computer in the loop with the surgeon. Right? And that's an opportunity. That's really what we see. And I agree completely. We're not going to replace the surgeon anytime soon. But what we're doing is we're really amplifying their hands, their eyes, and their brain. Right? The robotic instruments make their hands better. The eyes part, it's the visualization, allowing them to see the unseen. Hopefully there's no copperhead snakes in the abdominal cavity. But it's also their brain, right? It's allowing them to have confidence of doing the right thing. They're doing the right steps. And sometimes you only do a procedure once every 3 months. Well, having just like Google Maps in your car, it helps you, guide you. That's reducing your cognitive load. So it's really about bringing precision and predictability and personalizing medicine as well. That's another part of what Hugo is doing.
Yeah, I mean, it's robot surgery aside, it's really an augmented surgery. We're used to seeing surgeons wearing magnifying glasses to see very small things. We're used to, I guess, they're using devices to be able to make very small, minute, granular movements. But all those technologies, can you just give some examples of like what kind of superpowers technology can give surgeons?
Absolutely. Maybe I'll go to an example of a robot that we built for spine surgery. So when you have a spinal fusion, for example, or you want to correct someone's curvature in their spine, they go in and they put screws into your vertebrae. Well, there's a lot of important structures right in your vertebrae. It's the spinal cord, the aorta. You want that screw to hold, obviously. You're putting it in a very delicate space. There isn't a lot of material there. Right now, they put those screws in by hand. They have a plan. They know what angle they should go, and we help them navigate. But the robot, that assists the surgeon, right? So you can have this plan exactly where the screw should go. The robot actually is holding a guide and allowing that surgeon to have precision of just a few degrees. And what's cool, and this is where the AI comes in, we can predict the outcome of that procedure before they make an incision. Why? Because we can look at the nearest neighbors, look at other patients who have had a similar condition, and we can give them a very precise plan that creates the outcome that the patient wants and needs. So again, bringing the computer in the loop with the surgeon amplifies their abilities.
Do you want to talk a little bit about the vision and?
Sure. Yeah. So a couple of our digital solutions that we have that may seem, elementary at first glance is the idea of digital measurement and laparoscopically, that we're able to measure distances between 2 points, and we can measure that kind of as the crow flies or as the car drives over the contour of the anatomy. And so once you have that digital measurement, you have a length, you have a width, maybe you could get a height, and now you have an area, then you have a volume, and maybe that can be very helpful information as far as planning our kind of approach or how we're going to get to something, how big something is, or documenting how big this certain thing is that we're looking at. So that as far is one element that's currently available. We also have eye tracking that we can track the surgeon's eyes as they move their eyes. Oh, I'm looking over here, and so the camera follows me over here to do this, or I move over here, camera follows me over here. Or maybe we don't want that level of intrusiveness into the surgical procedure, but we want to see how many times people do this during the operation or do this in the operation, kind of a thing. And we can see their engagement. We can tell a lot by their eye movement as to how things are going or what's going on. So those are a couple of the features that we have that we're excited about.
So is the surgeon looking at a screen? Like, are they toggling between the surgical field and a screen to sort of do these checks?
Yeah, I think for both of us, Bill, we have the instruments in the patient. The patient, say, is at this table, and the instruments are going in there, and the surgeon's sitting over here looking at the monitor because there's a camera inside the patient and moving things here while looking at the monitor, and the arms are moving over here. And so that's robotic surgery, but the enhancements that we're talking about are these digital enhancements that come onto the video screen that say, oh, you want to measure something on the screen here? Well, nothing's really happening there, as far as the measurement in real life, but we're able to measure dimensions here and eye tracking over here and things like that as to what's going on at the interface of the surgeon with the monitor.
And it's also providing, I think, assistance where you can start to see critical structures that might not be obvious. For example, if you're doing hysterectomy, removing someone's uterus, you have to be very careful that you don't damage the ureter. That has very negative effects for the woman in that case. It's not always obvious where that is. Well, you can bring in AI, and it's looking over the surgeon's shoulder, if you will, and it recognizes through pattern recognition, oh, this is where that ureter is going, and it can highlight it so that they can avoid that structure. So it's hugely impactful.
Yeah, so I think we've got a little taste of the state of the art. One of the things we also talked about is how this can really revolutionize surgical training and a surgeon's understanding of their past performance and ways that they can improve their future performance, which is not obvious for a lot of surgeons. So maybe, Ed, I think we talked about it first.
Yeah, so we had the, my kind of area within our group is to come up with training programs for people to, use the system quickly and as efficiently as possible. And so that's then depends on, well, what is your background when you come into this environment? Then you want to learn how to use the system. Have you used a system like this before, or are you a surgery resident? Are you a medical student, or are you a well-experienced surgical practitioner that's been around for a long time? And can we find ways to understand through very short time periods how proficient you are, or comfortable you are, and then prescribe training programs to get everybody up to at least the same level relatively quickly in their safe and effective use of the system. We're not saying currently we're training surgeons to do surgery. We're training people to be proficient on the system as quickly as possible, and that comes with some surgical maneuvers that we think they probably need to understand to then be able to then go and practice surgery on patients.
Yeah, I think one of the things that we're doing with our touch surgery application is we're actually taking the video from, because we're recording it, they have the camera inside the patient, we're recording it and providing a service where it can actually, it knows what procedure you're doing, and it can divide that automatically into the phases, steps, and tasks of that surgical procedure. It says, oh, I know you're exposing this particular organ, or you're doing an anastomosis, or you're dissecting here. And why is that impactful? I think is because by segmenting it down, then you can start to compare how long it took you to do certain tasks during a procedure. The surgeon actually, when they complete the case, as soon as they leave the operating room, within 5 minutes, they have access to that video on their phone through this app. And they can say, hey, I struggled with the anastomosis part. Can you just show me that video? So rather than having to go and fast forward through the procedure and find where that is, too far, go back. No, it's just right there. They can just pull that segment out. But once you can do that, then you can start to compare surgeons against each other, and you could start to see what does an expert surgeon do compared to a novice. What is happening regionally? Certain hospitals may be using 4 sets of staplers and others are using 3. Why? What's the clinical outcome change of that? And you could start to have conversations about economics with this. So again, using AI for something as simple as recording video and segmenting it leads to lots of future benefits that are really about not only outcomes, but it's the finances and it's the efficiencies piece that we heard about this morning.
So it seems to me, that I've watched a lot of ER dramas. We talked a lot about that on our call too. So I'm basically a doctor.
Excellent.
See one, do one, teach one. Like, am I right? That's like year one.
Right.
It seems to me the value of that video would be extraordinary if every resident in the hospital or every resident in the country could watch it. I don't imagine surgeons want that to happen.
Well, I think the there is a reluctance to say compare your video to somebody else's video, and that's going to affect reimbursement or something. Yeah, I don't think that anyone's real excited about that. But if there is a way to say, let's take a surgery resident and you're training on something, maybe it's on the simulator, and you get pretty good at this on the simulator, and you're able to track that performance through your surgical procedure and say, you didn't do that like you did it here. Like, why? I mean, I've taken one golf lesson in my life, and so I'm not a golfer, but they videotape you swinging the golf club, and you're like, okay, and you're there. I'm really good. By that end of that hour lesson, they show you what to do, and then it falls apart when you go out on the golf course. And why is that? Why I thought I knew what I was doing. Can I go back to that? Or where's that person telling me what I'm doing wrong now that I was doing right after my hour coaching session over here? Can I pull all that information through and then afterwards review my video of my procedure and compare it to peers or other benchmarks or things and say, how is this whole continuum of learning happening, and then potentially continuing in that learning paradigm even after residency, even throughout our careers, to be able to have a whole kind of portfolio of learning of surgery. That's what I get excited about.
And I think also surgeons are similar to professional athletes. They want to get better at their craft, right? So if you can show them, for example, with a robot, we know how they move their hands. We're recording all that in addition to the video. So if you can start to give them insights of how they can be more efficient, how they could tie the knot so it would stay more precisely, they love that, right? It's amazing. Some of these training systems that we have, we set it up at a surgical conference, and you get a score. Surgeons will come back because they want the high score. Right. and that's the way they're wired. And so I think these insights are actually really powerful for them.
Yeah, I think it's incredible. It's what AI is going to do to every industry, is be able to have these massive databases, that all this information, all this experience that can be captured through all these almost superhuman sensors, processed, and then delivered up in real time with people as they need it, and also so they can go back and learn. And it's like, learning through watching YouTube videos, only with incredible depth and granularity. It really, I think, it's pretty extraordinary technology. Final question: I want to know, when are the robots going to start surgery? No. What are some of the technologies coming down the pike that really excite you, that have either developed, you're working on in Medtronic, or they're coming down the road that you think are going to be really transformative?
Yeah, I love my job. I'll be honest. It's very exciting to be at this point in history working on robotics and AI and surgery, and how much it's going to help patients. We're at a turning point, in my opinion. And what I see is it's about augmenting those surgeons' hands, eyes, and brains, of making procedures more precise and predictable and personalized. But I'd say one area that I'm really excited about is endoluminal surgery.
You're going to have to explain that.
Yeah, so what?
Because I didn't know what it was.
So when you have normal surgery, you go through the skin, right? So you make an incision through the abdominal wall, you get into the abdominal cavity, you can do the procedure. Endoluminal is about taking a natural pathway that's already in the body. And there's a lot of natural pathways there, going through the GI tract, through the vascular system, through the airways, the urinary tract. You can reach almost any organ in the body by following a natural pathway through the body. So why would you, make a hole through the body when you can get there in a natural way? That makes procedures less invasive. Almost least invasive is what we're after. And that means patients have less pain, they recover faster. You can start to move procedures from the main hospital to an ambulatory surgery center, or even an outpatient. And that improves access. It's just this whole conference is about wellness. And I think that's really what I'm after. It's about creating sustained health. And these approaches, these endoluminal approaches, are about sustained health. And that puts more life in your years, no matter how many years you've got.
Amen. Ed, you get the last word.
Yeah, I think we talked about longevity and wellness and things. And for surgeons, one of the biggest problems is standing there at the table and trying to gain access to the anatomy that you need on the patient, putting your body in contorted positions and holding them there. And maybe it's not even as much for surgeons, but I know as a surgery resident that you spend a lot of time hanging around in awkward positions trying to provide somebody else access, and that takes a toll over time, mentally and physically, whereas these mechanical systems, we'll just leave them in those awkward positions as long as we need them to be, and we can remain comfortable where we are to, as Bill said, to decrease the cognitive load of what we're doing. And so I think the robotics are going to improve and make that interface of robotics increasingly easier and ergonomically more desirable, and hopefully prolong careers for surgeons too. But what we really get excited about are these digital solutions, and I think we're all, listening to this room today, people here are very comfortable and understanding about what artificial intelligence, or as we're talking, augmented intelligence, can do to a variety of fields. And that's coming for surgery. It's here now in a certain sense, but it hasn't really broken out yet, broken loose. And what the real kind of benefit will be, or how we'll remember this kind of evolution that's currently happening and we're in the midst of, we'll only know in retrospect, oh, it was when that happened, it was when this happened. But all of these things that we're both talking about, I think, is leading us to that very, very quickly. And that's happening right now. It's kind of a tidal wave of advancement. And I don't know which will be the big advancement, but it's coming, kind of a thing. So it's exciting.
All right, and that will be a wrap.